Somewhere in this country, right now, a family is sitting in a doctor's office hearing the word dementia for the first time. And in a portion of those rooms, the real cause was never sitting in their genes. It was sitting in their medicine cabinet the entire time in a bottle they were told was completely safe. I want to be upfront with you before we go one word further because you deserve to know exactly what this video is and isn't. This is not medical advice, and I'm not telling you to stop anything you are currently taking. What I'm going to show you is what the published research actually says about 9 everyday medications and their connection to memory decline, so that you walk into your next doctor's visit with real questions instead of no questions at all. Here's why this matters more than most people realize. Researchers who tracked memory decline in older adults found something that surprised even the doctors involved. People with the heaviest long-term exposure to a specific category of drugs had a 54% higher relative risk of developing dementia compared to people who avoided them. 54%. And the frightening part is that almost nobody taking these medications had ever been told that risk existed. Stick with me through today, because number 4 on this list is sitting in tens of millions of homes right now, taken every single night for something as ordinary as a stuffy nose or trouble sleeping, and almost nobody connects it to what happens inside the brain over years of use. Before we start, tell me in the comments how many prescriptions you currently take. I read every single one, and it genuinely shapes what I cover in future videos. Let's talk about what actually connects every medication on this list, because once you understand the mechanism, the rest of this makes sense instantly. Your brain runs on a chemical messenger called acetylcholine. It's the signal your neurons use to form a new memory and hold your attention steady through the day. As we age, the brain naturally produces less of it, so any medication that blocks acetylcholine lands far harder on a 70-year-old brain than it ever would on a 30-year-old one. Drugs that do this are called anticholinergics, and that single word is going to come up again and again today. Number 9, common allergy and sleep aids. The active ingredient here is diphenhydramine, the one inside most nighttime and PM medications on the shelf. It blocks acetylcholine directly, and research following older adults over 10 years found that regular long-term users had a meaningfully elevated dementia risk compared to non-users. Newer allergy medications don't cross into the brain the same way and are generally considered a gentler option worth asking your doctor about. Number 8, acid reflux medications, the proton pump inhibitor class, the ones taken daily for heartburn for years at a time. Long-term use has been linked in large studies to lower absorption of vitamin B12, a nutrient your nerves depend on, and researchers have also found associations between long-term use and elevated dementia risk in adults over 75. The goal doctors generally recommend is the lowest effective dose for the shortest reasonable time, not indefinite daily use without reassessment. Number 7, overactive bladder medications. These work by blocking acetylcholine directly in a way that crosses easily into the brain, and studies following adults over 65 who used them for more than a year found a substantially elevated dementia risk. Newer bladder medications work through a completely different pathway and don't carry the same acetylcholine blocking effect, which is a conversation worth having if this applies to you. Number 6, and this one surprises people every time, statins, some of the most prescribed medications on earth for cholesterol and heart protection. Your brain uses cholesterol to build the insulation around every nerve fiber. Some research in older adults has linked several years of higher dose statin use with increased rates of mild cognitive complaints, though the picture here is genuinely mixed, and statins also protect against stroke, which is itself a major cause of cognitive decline. This is absolutely not a reason to stop a heart medication on your own. It's a reason to ask your doctor whether your specific statin and dose are right for you long term. If this is helping you connect dots you'd never connected before, tap that like button. It tells YouTube to show this to more seniors who need to hear it, and tell me down in the comments how many of these 9 you recognize from your own cabinet. Number 5, benzodiazepines, the anti-anxiety and sleep medications. A large study following thousands of seniors over 6 years found that those using them for more than 3 months had a substantially higher rate of developing Alzheimer's disease compared to non-users. These are also medications you should never stop suddenly because withdrawal itself can be dangerous. Any change here has to be a slow taper done with your doctor. Number 4, an older tricyclic antidepressant still commonly prescribed today for nerve pain, migraines, and sleep. This is one of the most strongly anticholinergic drugs still in regular use, and it's the exact drug class behind that 54% figure I mentioned at the start of this video. A landmark study following over 3,000 adults over 65 found that the highest cumulative users over a 10-year window carried that 54% elevated dementia risk, and Alzheimer's risk specifically was raised by 63%. Newer options for nerve pain and sleep exist that don't carry the same acetylcholine burden. Number 3, a specific type of antidepressant that looks modern and gentle on the outside, but happens to be the one member of its family with strong anticholinergic activity built in. Research comparing it to other antidepressants in the same class found older adults on it showed measurably faster decline in short-term memory and word recall within the first year of use. This is exactly why some geriatric prescribing guidelines list it as one to use with real caution in older adults, with other options in the same family generally preferred. Number 2, antipsychotic medications, originally developed for schizophrenia and bipolar disorder, but increasingly used off-label in seniors simply to manage restlessness or agitation. Research following more than 25,000 older adults found those given these medications for behavioral symptoms had significantly worse cognitive decline within a year, even with no prior dementia diagnosis, alongside real risks around falls and stroke. If a loved one is on one of these for restlessness rather than a formal psychiatric diagnosis, that's worth a direct conversation with the prescriber about why. And number 1, the one that ties every single item on this list together. It's not one drug, it's the combination. Researchers call it anticholinergic burden, the cumulative weight of taking several of these medications at once, even at ordinary doses. A large study tracking over 200,000 older adults found that those carrying the highest combined burden had dramatically higher dementia risk over 10 years than those with the lowest. Most of them had no idea that burden even existed because no single doctor was looking at the whole list at once. Here is the hopeful part, and it's the actual reason this topic matters. Medication-related cognitive fog is often reversible when it's caught early. The path forward isn't fear, and it isn't stopping anything on your own. It's one conversation. Bring every prescription, every over-the-counter pill, and every supplement you take to your next appointment, and ask your doctor or pharmacist directly to review your total anticholinergic load. That single 15-minute conversation is something almost nobody has ever had, and it could change everything. So tell me honestly in the comments, how many of these 9 are sitting in your cabinet right now, and are you going to bring this list to your next appointment? Your answer might be exactly what convinces someone else reading this to finally ask. And before you go, there's another place your body has been quietly warning you, one most people never think to check. Your fingernails can reveal signs involving your kidneys, your blood, and your nervous system, sometimes years before anything else shows up. That's exactly what we're covering next, so stay close because you won't want to miss it.